In this video, I would like to talk about the very common condition of dry eye associated with a poor tear film. The tears that lubricate the surface of the eye are there for two main reasons. Primarily, it's to allow the cornea, which is the clear window at the front of the eye, and the main focusing surface of the eye to remain clear and smooth and provide a good optical surface to allow the light to focus onto the retina, which is why if you have a poor tear film and dryness of the eye, you can sometimes have blurring of vision, which improves on blinking. And the second reason we have the tear film is to wash away any debris that forms on the surface of the eye, and hence if you have a poor tear film you can have uncomfortable eyes. So the most common symptoms are gritty, sore eyes. This tear film is in fact made of three components. There's a watery component, which is the main component, but there's also a mucus layer, which is acting as a wetting agent to allow the water to stick to the surface of the eye, and in particular the cornea. And there's also a very important oily layer, and oil floats on water, so it's on the surface of the water, and that's produced by glands called meibomian glands along the lid, and this oily layer stops the water from evaporating. So you can have a poor tear film if any one or all three of these components are at fault. Now, most people with dry eye, it's something that's not associated with any significant general health issues, although there's a small number of patients with rheumatoid disease who can develop dry eye associated with a condition called Sicca syndrome and often have a dry mouth. A common eye association, however, is inflammation on the lid margins, blepharitis, which is part of another video that you may wish to view. But certainly the oily component of the tear film, which stops the water from evaporating, is produced by glands along the lid margin, and if the glands are inflamed, a condition called blepharitis, the oily tears are not produced as well as they should, and as a result of that the water can evaporate quickly and the eye can become dry because the oil film is not trapping the water as it should. Treatment of dry eye is therefore usually associated with artificial tear supplements and lid hygiene to bathe the lid margins to keep that oily component as good as possible. There are many artificial tear drops on the market, and some recent ones have been available which are preservative free, which is very useful in patients with very severe dry eye or reacting to preservative in drops. But there's a very large number out there, and it's a question really of trial and error to find one that suits you best. In terms of installation of drops, depending on the type of drop you use, most drops only last up to an hour, and therefore if you put drops in once or twice a day, there's only a very short period of time during the day in which you're lubricating the surface of the eye. So if you have bad symptoms, I would suggest initially putting the drops in every hour, every 2 hours, until you get on top of the symptoms, and then reduce the frequency of the drops. If you are also putting in other drops for glaucoma, for instance, do be aware that you must not instill your artificial tear drop soon after your glaucoma drop, otherwise it can wash away the glaucoma drop and reduce its efficiency. So it's important to put the artificial tear drops in separate to any other drops for other eye conditions. If you have problems first thing in the morning, in particular on waking, as well as using the artificial tears frequently during the day, there are some simple eye ointments that can be used to lubricate the eyes when you're asleep, to stop the eyes from drying out, and the important thing there is to make sure you put the ointment in just before you go to sleep, otherwise the vision will be very blurred. There's no point putting ointment in and then trying to read, so it's the very last thing you do, and that sometimes helps the eyes on waking, opening the eyes. So artificial tears are the mainstay of treatment together with lid hygiene, and usually by a combination of these two things most patients can have symptoms alleviated. And if that doesn't improve the situation, there are other treatments that can be available, such as plugging the tear passages that keep the tears trapped on the surface of the eye rather than draining into the nose in severe cases of dry eye.